For all verified facts, subscribe to our YouTube channel and click the bell icon to get the latest updates.
Hello and welcome. It's that time of the year again, almost. We are in a conundrum. Should we impose as a country a lockdown in general or in specific in some areas or not at all? What are the costs? First, let's look at what's happening. The number of COVID-19 cases have been rising steadily for almost a month now. We've hit almost 54,000 cases a day. In cities like Mumbai, it's hit almost 7,000 cases a day. In many places, cities as well as states, these are record highs, much higher than what we saw in 2020. Now, on the other hand, the economic cost of a lockdown, which was imposed in March last year, around this time, is also quite clear. GDP for that quarter took a severe hit, almost 24% down. We are obviously still to recover. The economic hit in India has been far greater than many other countries, though many other countries have also imposed lockdowns, and some actually even till today have some version of a lockdown or restrictions or much more than what India has. On the other hand, we do remember quite painfully that the one key impact of that lockdown was what migrant labor had to go through. And migrant labor, if you recall, particularly the images, went back to its villages, towns across the country, many of them walking in brutal weather conditions. We are entering the middle of what seems to be like an early summer now, as it was last year. And millions of people were on the road and suffered. So that was another consequence of the lockdown. On the other hand, like I said, the numbers are rising. And clearly, it is a challenge, or a public health challenge, as well as an administrative challenge, and a decision to take on how to control it, and what, therefore, maybe makes us re-examine the consequences and the merit of a lockdown. So, to discuss this, I'm joined by two experts who will look at it from two slightly different points of view. Rajeev Khandelwal, who is the co-founder and executive director of Aajeevika, a foundation that works on making labor migration equitable and freer and hardship in a growing economy. And Aajeevika has done a lot of work in South Rajasthan earlier and now expanded its portfolio. And Dr. Ajay Shah, a research professor of business at the Jindal Global Business School, earlier has worked with the Department of Economic Affairs of the Ministry of Finance and the National Institute of Public Finance and Policy, and also co-author of the recent book, In Service of the Republic. Thank you both for joining me. Ajay, let me begin with you. So here we are again, looking at the potential lockdown, even if it's a little different, and we seem to be left with almost no option, at least looking at it from a public health point of view. How are you reading it?
I'd like to think about two things. The first is that the lockdown experience of 2020 was not so great. Okay, with the benefit of hindsight, everything is easier with 2020 hindsight. With the benefit of hindsight, we know that it exacted a toll upon the economy, upon confidence. There is some evidence about excess deaths, and the seroprevalence survey data shows that actually it did not do that well on impacting on the spread of the disease. So I'm not excited about the gains that we got from the lockdown. The second thing that we should think about is that this is not the India of March 2020. Okay? We're standing here 1 year later, and the virus has actually already spread quite a bit. There is significant seroprevalence in large parts of the country. A small vaccination program has begun. So actually, we are holding a better hand of cards today than we were 1 year ago. And in this, I would emphasize that the data is not quite comparable. When a lot of poor people got sick last year, they didn't get tested. So in the official testing data, it sounds like there was a modest amount of disease, whereas today the disease is reaching rich people, and rich people are more likely to get tested. So what you call a surge in the data, I actually think is not a fair depiction, because actually things were worse last year than is narrated in the data. Because when we go and do the seroprevalence surveys, we always found dramatically more disease progression as compared with what the testing data appeared to convey.
Right. Okay. I'll come back to you on then how do we interpret a second wave. But let's get Rajeev in. And Rajeev, what are your early thoughts on this? I mean, we seem to be veering around to a lockdown, even while fully knowing that what a lockdown did last time, because in many ways we don't know what else to do.
You know, from where I am and from what I'm seeing, I would strongly argue against a lockdown. Lockdowns are probably successful in countries and societies that have a strong social protection, wage protection kind of programs, which we do not. The experience of lockdown especially in the first 3 to 4 months last year was harrowing for not just the people who were walking on the highways, but for those who came back to villages and waited it out to go back to cities. Now we are at a point right now where people have only just gotten back to work, and they have to make good their losses for the entire year. They are barely they're not at the same wage levels that they were earning earlier. Many have run up enormous amounts of debts. The social protection, the social assistance, financial assistance that was provided was very inadequate, was very erratic, and we cannot be in a situation again where people are forced to go without wages for any length of time. Okay, and I'm particularly talking about daily wage earners, people in the informal spaces, in informal markets, construction workers, manufacturing sector workers, service sector workers that have only just got back. And I think we must not push them back on, to a scenario from which they will never recover. I would strongly argue against that. Our systems just do not support a severe kind of a measure like a lockdown.
Right. And yes, CMI data, for instance, did say that almost 120 million jobs were lost when measured in April and May last year. Of course, many of them did, most of those jobs did come back, also suggesting the nature of the informal economy. So, Rajeev, what's your sense? I mean, how will then, if you were to put yourself in the other side from a public health point of view, the same people whose jobs we are trying to protect, we are also trying to protect their lives. And the fact that if the cases increase dramatically and more people are sick, then the health system does not have the ability to absorb it.
Well, that's where I think we need to make more investments. We need much greater vaccination. We need to escalate that effort very rapidly. And like Ajay said, we are not in the same situation today. The seroprevalence is already much higher. It is easier to protect people from a massive surge. What we are going through is possibly temporary, and I would say that we should just max out on vaccination and ensure that the last mile kind of the population is receiving it and not getting and entry barriers are not placed on them. And therefore, there was some discussion about even conducting door-to-door vaccination, which I would actually support, given the kind of situation that our workers are usually in. For them, accessing public health facilities is not very easy. I would also argue strongly for improving public health systems in urban areas that workers have already reached. Actually, the situation is better in rural areas. The prevalence is lower. It was never as high as the urban areas. And I would say that in migrant sensitive, dense clusters where rural migrants have reached cities, that's where we need to improve our health delivery systems. And they continue to be where they were. In fact, they're even worse because they're still under-resourced. That's not where typically the vaccination drives are being amplified. They're still being amplified in the more core kind of urban centers, at least from our experience in cities like Ahmedabad and Surat. The outlying areas where there are large populations of workers living in the open, living on pavements, living under flyovers, or inside factories. That's not where vaccination is happening. We need to escalate that and not kind of turn to lockdown as a solution, I would say.
Right. Okay. So we need to escalate the administering of vaccines, but which also brings us to the question of, do we have enough vaccines? We've exported almost as many vaccines as we've used within the country at this point. But that's a separate question, and I'll come to that. Ajay, I had spoken to you earlier, and you had argued, this was a few months ago or many months ago, that one public policy response could be to have very, very sharp and select and specific lockdowns. I mean, which is what in a way is being argued to right now. For instance, in the city of Nagpur or Amravati, where clearly the flare-up has been way beyond what anyone could expect or even hope to respond to. Is that something that you still hold?
Yeah. So as the experience of the last year has demonstrated, it is not very useful to think of the Republic of India as a unit of organization, because this is a vast territory and conditions are extremely diverse in different parts of the country. Or even inside Bombay, Mulund is different from Bandra, and so on. So we should be thoughtful. We should apply medicine where it is useful in a balanced and judicious way. And we should use low cost tools rather than high coercion tools. So, for example, I'd be far more comfortable with a greater push in favor of using masks. Okay, masks are an effective public health strategy. They deliver results, and that's the first port of call. That if you're willing to use state power, we should be using masks. The second port of call, in my opinion, if you want to use state power, is high density gatherings, which is basically temples, weddings, movie theaters, clubs, nightclubs, bars. Okay, so those are high density congregations. Yeah, there could be a case for saying that we should use state power and interfere with those. But most important, I would always reiterate that the most useful thing that the government can do is to produce better data and disseminate it. Okay, people in Bandra East should know what is the attack rate in Bandra East, which is what is the percentage of people who are actively spreading the disease in Bandra East, as opposed to Bandra West, and so on, so that each local neighborhood can make their own decisions. That let's not think in terms of blunt tools that go have a very large impact all over the country and are much more disruptive. Let's be surgical. Let's use local thinking, local precautions. Let communities talk to each other and think about what they want to do.
Right. Rajeev, Ajay is referring to suburbs of Mumbai. I know you're based in Udaipur, if I remember correctly. Tell us about, if assuming there were to be a lockdown, I mean, maybe public administration, we may not like it, but maybe that was the only way they would respond. Would you think that migrant labor would be better prepared in some ways? And, as part of the reaction in the last time was also out of fear and uncertainty, not knowing what's going to happen and so on. And therefore, many of them try to go back to their villages. Maybe that could be different. Is that possible from your understanding?
There is already some talk about lockdown coming into force, right? And at just this time when people have come back to their rural homes during Holi, they're waiting it out. For example, where I am, most workers migrate to Gujarat and they are waiting it out to see if Gujarat will introduce lockdowns. It probably will not introduce lockdowns, but it will certainly introduce restrictions on movement, which is at the border. There is all kinds of, COVID reports being demanded, which is not a cheap kind of a, thing to obtain, for an average worker. It still costs between 500 to 800 rupees. And that's not a good way to, to prevent people from, acting responsibly, I would say that their preparation, they will probably have better transportation. They'll probably have, they would have learned from the experience of last year if they were to get back. But there would be no preparation in terms of their livelihood. Okay, they will not have a second choice back in rural areas to see through a period of no earnings or no wages or no access to ration and so on, if any length of time for a lockdown is introduced. Yeah. So I don't think that preparation is any better than last year's. Financially, people will suffer as much as they did last year.
Okay, and that's an important point to note. Ajay, what's your sense? I mean, economically, if you were to now look at the last 4 quarters and 1 year, I know we've recovered, the economy has recovered, in most of the informal sector jobs have come back, the formal sector job losses still remain high, more than 20 million as per my understanding of CMI data. So what's your sense in terms of where we are today in our ability economically to take another shock or mini shocks if across the country, if that were to be the case?
I think there's quite a bit of economic stress. There are many personal loans which have enjoyed moratoriums where people will have to start repaying. Similarly, for many firms, There have been debt moratoriums, and sooner or later that process has to end. The IBC process was suspended, and I think it's a wise decision by the government that we're going to get back to IBC. And the fourth, that while the number of jobs is indeed only slightly behind pre-pandemic conditions, we have to locate this in the context that the number of persons working has been about stable for a long time now, from about 2015 now, while there has been population growth. So actually the economy is not growing enough to absorb the growing workforce. So the working age population has been growing, and the economic growth is not doing well in absorbing the population, particularly in vulnerable subsets of the population, most notably women. Things are not good, that a lot of women have lost their jobs and they've not got back their jobs. So I think that this is a difficult time in the economy. We should be doing all we can to improve the confidence of private people to build a business and invest and commit to taking interest in building a business and growing an organization in this country. So even the uncertainty that tomorrow there can be a lockdown is a cost, and it has an adverse implication upon how the economic outlook fares. So in my ideal world, I would advocate thoughtful, intelligent, careful measures rather than blunt measures. And I would encourage the authorities to go public as quickly as possible and say there will be no lockdown, because that will increase everybody's confidence.
Right, and I mean, that's really picking up on what Rajiv was saying, that you know, if the fear that something might happen is already holding some of the migrant labor back, particularly in South Rajasthan. So Rajiv, you know, the government at that point, particularly in August, September, you know, last year, once it became clear what the damage, the social and economic damage of the imposition of the lockdown was, particularly on people and their lives, set out on doing many things, including creating, you know, a sort of net for migrant workers, databases. Where are we on all of that?
It's still very, I would say it's still very superficial. Okay. There's a lot of random data collection. There's a lot of skill mapping and enumeration without a very clear outcome. We do not still have programs in place that will protect wages, that will universalize public services in cities, that will ensure you know, that legal aid is available to workers who lost wages during the lockdown period, that will ensure that social security is widely available. You know, the core issues that trouble or that jeopardize the conditions of informal workers in the country, those have yet to be addressed. Okay, what has instead happened is a lot of I would say poor data collection without any clear kind of a goal, and that too is meant, it's not very clear to people why all this data is being collected, and several states have launched that you know, there are now portals of collecting data on migrant workers in order to track and to ensure that they are able to find jobs and so on. None of this is going to work, Govind, because you know, this will actually peter out quite quickly, because the economy gets back to business as usual pretty soon. It has, you know, it will restore to where it was, and urban services, rural distress will remain where they were, and none of that remains, you know, on high on the agenda, on concrete agenda. There are also kind of policy statements now from various quarters, and I think all of these will need a lot of structural kind of, you know, changes on the ground. They need to be made operable and not just be, you know, rhetorical kind of statements about protecting migrant workers' rights and migrant workers' protection. And we need to focus on two things, which is ensuring formalization and ensuring universalization. Okay, which means that everybody must be able to access services, and the informal should move to formal, which means that their wages should be protected, their social security must be ensured. Without that, you know, it is only, we will repeat. The pandemic was finally an application of what already existed. You know, until that changes, I don't think the conditions of migrant workers will change very much.
Right. So just if I can get a one line sum up from both of you. So Rajiv, you're saying lockdown or no lockdown?
No lockdown, absolutely not a lockdown.
Okay, great. Ajay?
I'm not in support of a lockdown. It will be desirable if announcements are made that there will be no lockdown, if that is indeed the path that we're going. And it would be really great to do better on vaccination.
Great, wonderful. We've run out of time. Thank you, Ajay and Rajeev, for joining me, and hope to speak to you with you both again. Thank you for sharing your insights.
Thanks.
Thank you very much.